Show you a welcome scene in Kentucky today. You're taking a look inside a warehouse and the very first shipment of Johnson & Johnson's COVID vaccine after it got emergency use authorization over the weekend. The CEO of the company says those shots will be in arms within the next 48 hours. And unlike the other shots that are out there, people don't have to come back for a second dose, at least for now. This is a one-shot vaccine, which the trials show is 66% effective overall. 85% against severe disease and 100% effective at preventing hospitalization and death. Joining us live to talk about this latest development is Dr. Thomas Russo, Chief of Infectious Disease at UB. Dr. Russo, always great to see you.
Yes, good to see you again, Kate.
So I want to start with the Johnson & Johnson vaccine, and that 66% number is a lot lower than the other vaccines that are out there right now, even if you have to get the 2 shots for Moderna and Pfizer vaccines. And we know that there are people who are concerned about that and about getting the Johnson & Johnson shot because of that. What would you say to them?
I would say forget about the 66% number, the 85% number, and focus on the one important number, 100% number. This vaccine and our RNA vaccines are extraordinary in keeping people out of hospitals and preventing bad outcomes. And at the end of the day, that's really the most important measure of these vaccines. The Johnson & Johnson vaccine matches up extraordinarily well with that respect. So I would definitely grab what you could get when it's your turn to get vaccinated.
So that shot only takes 1 dose, the others take 2. And we heard from leaders last week concerned about people who just aren't showing up for their second doses. There's always this human element. How big of a deal is it as we try to end this pandemic with herd immunity?
It's critically important for people to receive both shots of the RNA vaccines. That second shot results in the maximum degree of protection and will also increase the durability of the vaccine. And this may be particularly important in protecting against those pesky variants that we've been hearing about. So please, even if you've missed your second dose, it's not too late to reschedule, even if you get it a few weeks later. But please get that second dose in your arm to protect yourself and others.
We got a question from a viewer that we'd like to pose to you. It says, if I'm trying to get pregnant or am already pregnant, should I get the vaccine? My OBGYN suggested I hold off trying to get pregnant if I'm going to get the vaccine soon. So first of all, great to ask your own doctor, right? Because they're going to know you better than anybody. But Dr. Russo, what is your best advice and what insight can you give us as far as pregnancy and the vaccine? Because this is a question that we get quite a lot.
Sure, and this is a very important question, and there's ongoing data that's being collected to most help individuals make the best decision. So the CDC, the American College of Obstetricians and Gynecologists, and the Society for Maternal and Fetal Medicine all recommend that the RNA COVID vaccines should be offered to pregnant women. Those women should have a discussion with their healthcare provider and assess the relative benefits and risks and make the best possible decision for themselves. Now, to inform about what that best decision is for an individual, there's a few things that we know at this point. First, everything being equal, pregnant women compared to non-pregnant women are much more likely to have severe disease that results in hospitalization and a bad outcome. Fortunately, that number remains low, but it's not 0. And if a pregnant woman has additional comorbidities, that may magnify that risk. So that is one important fact. The second important fact is that data suggests that premature birth is more likely if you're pregnant and get infected with COVID, particularly if you develop severe disease. The good news, there's some good news though, Kate, as well. That pregnant woman is unlikely to transmit the coronavirus to her baby, and there's no evidence at this time that there's any congenital abnormalities with coronavirus infection. So that are some of the facts. Now, with regards to the vaccine, what do we know at this point in the vaccine? A couple of points. Obviously, you're not going to get COVID from the vaccine. People are still confused about that. And there's no data to suggest that vaccination will affect fertility. And that's critically important. And there's a lot of stuff going on social media that are misconceptions about that. And though our database is still evolving based on animal data and pregnant women vaccinated to date, there's no safety signals of concern at this point. So those are the facts that we know, and each individual can make that decision that's best for them. Obviously, if you're thinking about getting pregnant, getting vaccinated as soon as possible is a good idea. And if you are pregnant, discuss these points with your healthcare provider and sort out what is best for you.
And that was one point that I want to just clarify with you, because we were talking about women who are already pregnant, but it's also safe as far as women who want to get pregnant.
That's absolutely correct.
All right, Dr. Thomas Russo, we have to leave it there for tonight. Always appreciate your perspective. Thanks again.
Great to be with you again.
All right, thank you. And thank you, everybody, for watching our town hall. Remember, you can always text us your questions and comments, 716-849-2200. Scott and Mary Alice are back with Channel 2 News at 6. Right